It is no secret that pregnancy comes with all kinds of physical and mental hardships that even last after the child is born. But a lot of advice that is passed down to women isn't always rooted in science. That is why our next guest is here to dispel some common misconceptions about pregnancy and being postpartum. Let's bring in clinical pharmacist and founder of Miri Health, Dr. Pinkey Patel. Dr. Patel, so glad that you're here. So there are a lot of symptoms that women experience during pregnancy, right? And they just shrug it off because they're like, this is just part of the whole deal. When should you take your concerns to your doctor, call your OB?
Yeah, so one of the things is, as we're told whenever we're pregnant, it's just uncomfortable.
Yeah.
Right? And so if it's common, it's probably normal and it's harmless. So think about things in pregnancy that are like a headache. We usually shrug a headache, under the rug. But if it becomes persistent, if there's sudden swelling that's unilateral, if there are vision changes, and some of those things will suggest potentially preeclampsia. There could be a risk of stroke. So these things, I'll commonly tell women to advocate for themselves.
Yes.
Because whenever you're pregnant, they just chalk it up as, well, it's uncomfortable.
Right.
It's fine, it's normal. And you have to continuously research for yourself and advocate. But the headaches, the swelling, the pain in chest, shortness of breath, those are concerns that you should bring up with your provider. And if they're persistent,
listen to your body. Don't just say this is just pregnancy.
Correct.
There is a second myth here that a lot of people assume that the danger to the woman is over once you give birth to the baby. You say absolutely not.
Absolutely not. So 53% of pregnancy-related deaths will occur in postpartum. So it will be between 7 days postpartum all the way through 12 months postpartum. So typically you have so many touch points in pregnancy, right? So you see the provider. The shift happens when you get discharged. It's all about the baby. What about the mom?
Right.
So typically, it's how many diapers should you expect? How do you feed the baby? Put the car seat in the car. The mom essentially just gets kind of shoved under the rug. And primarily the concerns we chalk that up as, well, she's just tired. You have the largest shift in your hormones and chemically in your lifetime since birth. And so things like postpartum hemorrhage, postpartum preeclampsia. So you can have zero hypertension in pregnancy, but you could actually have postpartum preeclampsia, hemorrhage, and mental health.
Yeah, mental health is important.
Mental health is very important, yes.
Postpartum has been in the headlines a lot lately with this Lindsay Clancy trial. Some women think, okay, it's normal to feel sad or anxious or even depressed after, giving birth. But what do you say in terms of trusting your gut? When should you seek mental health and a doctor's appointment if your feelings are really out of control? Yeah,
so I'll say one thing here. You have one appointment typically at postpartum, it's at 6 weeks. You get a questionnaire. And when you talk about maternal mental health, it's not just postpartum depression. Right. It could be postpartum anxiety, OCD, bipolar, or postpartum psychosis, as we've seen in the headlines. And so it's really important to distinguish between what it is and also not rely on just a questionnaire. I lied on my questionnaire at 6 weeks. So it doesn't end there, right? It's the follow-up and the actual care of the mother. Now, there's a difference between baby blues and postpartum depression, because baby blues could be a few days after giving birth up until 2 weeks. But postpartum depression looks different on everyone. So you could be a hyper-functioning mother. They typically associate a woman crying in bed and sad with postpartum depression, but that looks different. And so advocating for your care and ensuring that your partner and your village knows what to look for is very important. And then knowing that treatment is available.
This is such an important conversation for moms, but like you said, the village, everyone around you, speak up. If you see something, say something, look out for that new mom in your life. All right, Dr. Pinkey Patel, thank you so much.
Thank you so much.
Sam, we'll send it over to you.